Now let us begin by discussing causes of urinary symptoms besides BPH. The first cause is infections and inflammations. Infections are the most common causes of urinary symptoms, particularly in women. Examples of infections include urinary tract infections or UTIs. Bacteria present in any part of the urinary tract, that is the urethra, the kidney, the bladder, can cause frequent and painful urination, urgency, and sometimes blood in urine. Next on the list is prostatitis. Prostatitis refers to the inflammation or infection of the prostate gland, not necessarily enlargement. This can cause pain in the pelvic area and urinary symptoms, particularly in men. Sexually transmitted infections such as chlamydia, gonorrhea, and herpes can cause urethritis, that is the inflammation of the urethra, and lead to painful urination and discharge. Next on the list is interstitial cystitis, that is painful bladder syndrome. This chronic condition involves inflammation of the bladder walls, causing frequent urination, urgency, and chronic pelvic pain, often without an infection present. Urinary symptoms can also be caused by neurological conditions. Now, the following neurological conditions can cause urinary symptoms. So the first one is stroke. Stroke can interfere with the brain's ability to control bladder function. Now, another cause of urinary symptoms is multiple sclerosis, also known as MS. Multiple sclerosis affects nerve signals, often leading to overactive bladder. We can also call it inability to empty the bladder completely. Another cause is Parkinson's disease. Parkinson's disease is a disorder of the central nervous system. Parkinson's disease may cause neurogenic bladder symptoms. Another neurological cause of urinary symptoms is diabetes. High blood glucose level can damage nerves. Nerve damage or neuropathy may actually affect bladder function and also damage. Neuropathy over time may affect bladder function and sensation. Another cause is spinal cord injury. Trauma to the spine can disrupt nerve communication. This may lead to loss of bladder control or urinary retention. Urinary symptoms may also be caused by structural and obstructive causes other than BPH. Physical obstruction other than BPH can block urine flow, and in the process this may cause symptoms. Now, one of the physical or structural causes is urethral stricture. Urethral stricture, in this case we are talking about damage to the urethra, which may lead to formation of a scar. Now, this tissue may narrow the urethra, making it difficult to pass urine. Urinary symptoms may also be caused by bladder or kidney stones. Hard mineral deposits may irritate the urinary tract or cause blockage. Now, this may cause pain or urinary frequency. Another cause may be tumors or cancer, that is cancerous or non-cancerous growths in the bladder. Now, these growths may also be present in the prostate or the surrounding pelvic area, and therefore, this may obstruct urine flow or irritate the bladder in the process. Urinary symptoms may also be caused by pelvic organ prolapse. Now, in women, weakened pelvic floor muscles can cause organs such as the uterus or the bladder to suck into the vagina. Now, this may kink the urethra and obstruct urine. Now, another important cause of urinary symptoms is constipation. Rectum that is full of compacted stool may put pressure on the bladder. This may lead to frequent urination or a feeling of incomplete emptying. Urinary symptoms can also be caused by systemic diseases and other factors.